Hey, afternoon, everybody. Eric with American Business Systems here. Hope that you're having a great Wednesday afternoon. Here we are already the third week of February. Gosh, folks, this year's going by so fast already. It's unbelievable. For those just tuning in, thank you for joining us this afternoon. We're going to be talking about our topic this afternoon: explore why medical billing is a top choice for you in 2026. So we'll be going over some statistics today. A little different some of other things that we've done in the past, where we kind of focus in on some things here at ABS, but we're going to be talking about some industry wide things. Why do this from the very beginning? So this will hopefully be a very educational type of webinar for you this afternoon to kind of help you make your decision as you're kind of surveying all and scoping out all the different types of business opportunities and franchises that are out there. And we are certainly glad that you joined us this afternoon. So again, we're going to be talking about really why medical billing is a top choice for home-based businesses, or a business opportunity, or some of you that are looking to franchises. You're looking at a franchise opportunity. Why does medical billing, and why is it still a top choice even today? So I'll tell you this, that I've been around ABS now going past 18 years here, and it is as strong as it's ever been. And I'm looking forward actually to the webinar that we're going to be doing next Wednesday. And I'll tell you a little bit more about that as we get closer towards the end. But I want to welcome you here this afternoon. For those that are just logging in, thank you for joining us this afternoon. Since you guys are on time, we're going to get started here with the first couple of slides. I'm going to introduce myself. Some of you might know who I am. I've been doing these webinars for quite some time. My name is Eric Auger. I'm the Director of Learning and Engagement here at American Business Systems. So I'm so grateful that you've carved out some time to join us this afternoon and join me for the next hour. This hour will go by pretty quickly. So if you've got questions that you have for me throughout the presentation, feel free to ask those there. I want to make sure that everybody's hearing me. So if you don't mind, do me a favor. Go over to the Q&A box. Just tell me where you're calling in from this afternoon. I would appreciate that. That would be great. I always like to know where everybody's located. So if you don't mind, start typing that in for me. I'll start waiting for a few of those. And then in the meantime, this is also a place where you'll ask your questions. So there'll be, throughout the presentation, you're going to have questions. I want you to be able to type those in. So this is where I'm going to be looking. So if you don't mind, just jump on in there. Very good. Elisa is from Florida. Good to have you here. I appreciate it. I'm going to open up my attendees box. I see Galba. Here comes some more. Kimberly from South Carolina. Keebla. I hope I said your name correctly. I'm always looking at and making sure I've got. Listen, people butcher my last name, so forgive me if I didn't say it correctly. Keshab is from New Hampshire. And we've got Mauricio from San Antonio, Texas. So folks, we got folks from all over the country here this afternoon. There's some other folks that are looking to join in here. I see that they're just about to come in. But we're going to get started here. We're going to be exploring again why ABS, or why medical billing, is still a good choice to at least investigate as you are looking into some type of business opportunity. Let me introduce you to the leader of our group. His name is Adam Phillips. Some of you may actually be talking to Adam. Adam is our CEO, has been for the last few years. He took over the reins from his dad, I guess about 10 years now. So he's been at this for quite some time. Adam has written some books. He's co-authored a book with Dr. Vicki Rackner. Now, if you don't know who Dr. Vicki Rackner is, I'd ask you to go back to our YouTube channel and look at last Wednesday's webinar. Dr. Rackner and I did a pretty thorough webinar on what the perspective of the importance of having an outsourced medical billing company doing the billing for a doctor from a doctor themselves. But she helped co-author this book with Adam's 9 Ways Doctors Let Money Slip Through Their Fingers. And so you're going to want to get a copy of that. Adam is also a part of a guest, if you want to call it, a contributing writer for a magazine called Billing and Coding Advantage Magazine. He's got several articles out there. And the reason I'm telling you about this because I'm actually going to interview Adam next week. Now, a lot of you may have been talking, like I said, you may have been talking to Adam. Some of you may have joined us on a Wednesday webinar where Adam and Jason are talking about giving you questions, opportunities to give questions and them to give you some answers. But next Wednesday is going to be an opportunity for me to actually just interview Adam. We're going to be talking about all sorts of things. Where the company's been in the past, how it got started, where it is today, and where Adam is looking to take it here in the future. And folks, yes, I'm sure we'll talk about artificial intelligence because we're going to talk a little bit about it today. And that's always a high key thing that people are always asking about. What about artificial intelligence? But Adam has actually written an article about artificial intelligence and how it's actually helping our medical billers today. So if you'd like to get with your sales rep, ask them for the article that Adam wrote on artificial intelligence, and they'll send that to you. Now, he is also the founder of an organization called MERVA. That's the Medical Revenue Management Association of America. It is the largest group of independent medical billers in the United States. And it is this group here that will actually certify you once you've completed our training. So they'll take it, they evaluate everything, and then they'll certify you as a certified medical revenue manager. All right, folks. So let me also remind you that in that Q&A box, I've got some folks that have come in a little bit late here. So for those that have come in after we've talked about this, so I think Michael, I think you're there, and Sankar, you may have come in a little bit after I mentioned this earlier. But if you've got any questions throughout the presentation, I'd like for you to take that opportunity to just type that on in there, and then also do me a favor. This is a favor I'm asking everybody. If I answered your question satisfactorily, if you don't mind, there's a little heart or a thumbs up. Just give that to me so I make sure that I know that I can keep going on. If it still needs a little bit more, there might be a question mark there that you might want to, or you can retype it in there if I didn't answer it correctly. But if I did get to answer it properly for you, just give me a thumbs up to let me know. I appreciate that. All right, let me remind you that first of all, before we actually get started with the topic here, that on our website, if you go to absystems.com, there is an extra download that you may not have known about. It's called Download the 5 Secrets to Success. It's a PDF. It's got some great information in it. Just go in there, just put in your first, last name, and email address. But inside there's some really, really great articles, and there are some actually white papers from some of our current medical billing companies that I think that you would appreciate and get a hold of to read. Okay. All right. Enough of the introductions. We've got a good group of people here this afternoon. So let's talk about why medical billing. Let's just explore what is the deal with medical billing? Has it met its day? Has AI killed it? I'm sure these are questions that that's probably floating through your head. And hopefully today I'll help answer and put some of those, what I call myths, to rest. Because folks, I tell you, a matter of fact, I went to a gathering last night where there were some other folks that are in healthcare. And I can just tell you that artificial intelligence is doing nothing more than enhancing both the physicians, the hospitals, the doctors' offices, and including those that are in healthcare and all the other different as vendors or helps to these doctors, and which includes medical billing. So I can tell you from right off the bat that AI is not going to take away anybody's job as far as we know. And again, if you didn't get a chance to watch the webinar that I did with Dr. Vicki Rackner last week, Dr. Rackner answered some of those questions directly as from being a doctor. So you might want to go back and look at that. All right, first thing we want to talk about is the opportunity. We know that healthcare economy is booming, and we say because we're in it. We're in it, and we wouldn't be here if we didn't believe this. And that it needs you. It needs people like yourself. Now, let me help you understand this. From a doctor's standpoint, I actually talked with another doctor who got out of practicing medicine. And she's a teacher now. She teaches at a local college here in the Fort Worth area. But she got out because during the COVID time, they couldn't keep up with their billing. They really struggled. And it was actually her and her husband. Her husband's a pediatrician. She's a family doctor. And they ended up struggling a little bit because of COVID. And you know, folks, it happens to the best of them. So let's listen. What we want, and this is one of the things that she stressed to me, Eric. She goes, I feel like the more that we lose our independent doctors to, you know, basically failing opportunities, the worse that our healthcare gets. So what does that mean to you? Well, it means that if you're able to help a doctor remain independent, that they're not an employee of a hospital, but they're independent, they think independently, they're able to, again, help the patient see those patients more than just 10 to 15 minutes. I mean, we talked about that at length last night. And so anyway, I'm just letting you know that there are doctors that would desperately need the help, and they're out there. And so, but regardless of that, we know that the industry in and of itself is certainly projected to be in the billions of dollars come 2034. Okay, so folks, what is that? Another 8 years from now, you know, that we're going to be there. So this is a growing industry. That you can see that I sourced this from Fortune Business Insight and S&S Insider magazine, and that is just coming from this year. There is a 12.05% compounding annual growth rate that's driving this industry. So, folks, if you are an economist and you are coming into this industry thinking as a CEO, okay, not just something to go, you know what, I'm trying to figure out something else to do here. I want to replace my job so I can just work at home, so I can have my own little business. Even if you're doing that, you've got to still have somewhat of a CEO mindset. So you've got to know, you've got to be part of an industry that has an annual growth rate that's in the double digits. Now, what you need to do, if you're looking at other opportunities, you need to see about what those opportunities are. Or do they have this type of growth? Maybe they got a fast growth, but it's not going to be there a long time. Folks, this has been compounding for years. And I'm going to tell you that the healthcare industry is nothing more than just in a continual growth. And 55% of medical practices report rising patient visit volumes. So the more that is their patients are going to see the doctor, and there's a reason for that. Obviously, our population is growing a little bit older now, and I feel like I'm one of them. Some of you out there in the audience may feel like you're part of that growth there too. We find that we're going to the doctor not just once a year, but now we're going twice a year. Sometimes we're going every quarter now. So it's picking up in a little bit of frequency, just enough to where we kind of go, oh, I've got a doctor's appointment in another 3 months. Some of you may be going biannually. But there's some of you may have to go once a month. And folks, there are people that literally go to the doctor at least once a month. And it may not be anybody here on this call today, but there are those that are going to the doctor. So there's an increase of patient volume in the doctor's offices. So what else are they going to do? What is that telling us from our side of things is that healthcare, private practice, independent medical billing, independent physicians' offices are going to need help. And again, if you heard Dr. Vicki Rackner from last week, you will also understand the importance of having this part of the business outside the four walls of the doctor's office. Again, whenever it's just there in front of the doctor's office and the person that's been hired to do the billing ends up having to do something else because someone didn't come in on time, or they've had to change billers or whatever else, and the I think one of the most important things that she said last week, why would a doctor pay somebody almost at the bare minimum over minimum wage and at a decent salary rate and hourly rate? But if you think about it, the volume of dollars that that person has to handle, it's better off that it's with someone that's an expert at doing that, and someone that is somewhat is tied to that. If the doctor makes more money, they make more money. So it's a performance part of this. If the doctor is just has someone there for $45,000, $50,000 a year, there's really no incentive for that person to really help the doctor unless they just really like the doctor. I'm not saying that those folks are not important or that they would not want to do the best job, but like yourself, who is an independent medical billing company, you're going to want to make sure that every claim goes through. You're going to make sure that if the claim somehow gets denied, you're going to want to make sure that that gets taken care of. So it's really important to understand to get that billing outside the doctor's office with a medical billing company, whether it's like yourself as a sole proprietor of yours, you create an LLC and you have maybe 2 or 3 other people that are working with you and for you. Doesn't matter. You don't have to have, as you'll see here today, no more than 2 to 3 doctors that are going to make you a pretty decent living. Okay, so we'll talk a little bit about that. All right, before I move on from the opportunity, I want to give everybody an opportunity to ask me some questions. So are there any questions about what we've said so far? If not, I'm going to move on, but I'm looking at my Q&A box here. So if they got any questions that are coming up, I'm kind of monitoring that as we go through this. Okay. All right. Fanny is asking, what's ABS's USP that other AB billing companies are not currently providing? If you were asking what ABS has that other medical billing companies are not providing, I'll be transparent with you. Every medical billing company pretty much does the same thing. Okay. What makes us stand out, though, is our platform, our iClaim and EMRX platform. So what I'm going to ask you to do, Fanny, is for you to get back with your sales rep and schedule a live demonstration of the iClaim and EMRX platform. We actually have 3 different versions of that. There are some that are versions that already have artificial intelligence already built inside of it. So it's actually helping the doctors be a little bit better. And I would also say this, our training is second to none. Because what we teach folks how to get started in medical billing and what we do is pretty incredible. Okay, so if you're looking for the advantages, there are several advantages, and I think one of the best ways to see that is actually to see the live demonstration of our iClaim system. So I think that's an incredible start off, because again, it all has to start with, do you have the right system? And so if you've got the right system, then you're going to be a step ahead, or what I like to say, you're the differentiator out there in the marketplace. That is a major part of this whole program here. All right. Let's move on here and let's get into the healthcare industry, the growth. A growing industry. Healthcare is an industry that simply won't stop growing. As you can see here back in 2025, and these numbers are in the billions of dollars here. We've already kind of talked about a growth already, that you've seen that so far. But you can see here over time, over consistent time of what you can see here, we're in 2026, we're talking over $20 billion worth of market share of outsourcing medical billing. So this is the medical billing outsourcing market trajectory. And again, this is from SNS Insider 2026 and SkyQuest 2025. So you can see here, I'm going to put up some other statistics here as we go. But healthcare in general is just it's amazing. Again, I got an opportunity to go be around other people in a healthcare industry that were coming from even from the dentistry side. But I was in at an event last night that there was some folks from the pharmacy industry, from OBGYN, from family medicine to hospital to dentistry, preventive maintenance, preventive healthcare maintenance there. So it's pretty this and everybody that I spoke with yesterday is excited about what's happening with AI. I think everybody in the industry, and I always ask the question to them, so do you think that AI is going to take over healthcare? And every one of them, and these are high level folks that I'm dealing with here, said, in no way that it's going to take away from the what's needed whenever it comes down to literal patient care. Okay. And I also think patient care goes to that same type of relationship between a medical billing company and their physician. You got to understand that you are like a financial advisor to a doctor. And a doctor's just not going to turn over their financial advisings for their retirement over just to some robot that they can't be able to pick up the phone and talk with some one of their advisors or counselors or consultants. So this part of growth here is even though it's growing, it may be with artificial intelligence. It's not going to even impact it to a point where you think it's going to lose its opportunity to do this. All right, I got a couple of questions that have come in. Uh, Kashib is asking, are there opportunities outside of medical practice? For example, non-medical home care service facilities who are funded through Medicaid. Folks, let me tell you this. If you run across a group, and this is so everybody, so get out your pen and paper. I'm going to give you a little bit of information here. Okay. I'll give you just a second if you want to take out a notepad. So when you're looking for a provider, see, we kind of get locked in on, oh, I've got to do a billing for a family practice or internal medicine or some type of specialist. I'm going to tell you, anybody that's in healthcare that does billing and they bill on a CMS 1500 form, you can do their billing. Okay? So let me repeat that. Any provider, any healthcare provider, you heard me, I didn't say a doctor, because there are a lot of people out there who are not doctors but are healthcare providers, nurse practitioners, PAs, obviously doctors are. There are licensed social workers that are out there. There are people that are in the mental health industry that are doing that. You've got folks that are in physical therapy, occupational therapy. You've got folks that are in massage therapists. They bill on CMS 1500 forms. They are a medical provider. They provide some type of medical care. So hopefully your world went from here to here just within the last 30 seconds. So to answer your question, even if they're funded by Medicaid, they're still billing on a CMS 1500 form, okay? So it doesn't matter if it's Medicaid, Medicare, Blue Cross Blue Shield, Aetna, Cigna, United Healthcare, all insurance companies, which includes those from the government, all bill on what's called a CMS 1500 form. Okay. All right. And Fonnie, I see your question. You said I can answer this later. And I will. Yeah. Let me just answer. Let me save that one to the end. I like that question. Okay. All right. So let's talk about North America. It leading. 55% of the global market share whenever it comes down to medical billing outsourcing. 46% of hospitals are already currently using artificial intelligence in their billing. They still have billing staff. Now I'm talking about hospitals, okay? So, but I'll tell you this, hospital billing and provider billing are two separate forms, okay? Hospital billing is what's called a UB04 form, okay? Whereas the provider, which what we do billing for, is a CMS 1500 form. So I've just got this statistic up here to let you know that there are hospitals that are already using AI in their billing, but it doesn't do away with their staff, okay? That's why I wanted to share that with you. And then telehealth is exploding. Just if y'all kept up with anything with the news here recently, you know we've had a couple of government shutdowns. I think we're still in one right now, but one actually impacted healthcare. And because of COVID, CMS said that they could, doctors, providers, nurse practitioners, PAs, several other licensed social workers, those who are involved in the mental health area, could see their patients via telehealth, okay, and get paid by Medicare. All right. So when the government shutdown happened, that actually impacted CMS, okay? So it really put a crunch on the healthcare industry, but they just got that fixed. It's actually been extended out further than 2027, so it's good for now, you know. I'm telling you, telehealth is fueling new demands. I'm telling you, because it allows the doctors to, at least the patients, to come in maybe for a hospital visit. An inpatient office visit, and then do their follow-ups weekly via telemedicine. Well, all that is doing is adding more billing. So let's say that little Mrs. Smith comes in, she's got some chronic disease, but the doctor wants to monitor her over 2 to 3 weeks. Well, instead of her always having to come back, well, at the end of the visits, well, what we're going to do, Mrs. Smith, we're going to set you up with a couple of follow-up visits with your doctor, and it'll be at the same time. And if you've got a smartphone, I see that you've got a smartphone. As long as you've got your smartphone, you're going to actually have a visit with your doctor in your own home. So, folks, let me tell you, this industry of remote patient monitoring, which is another one of our services. So I'm going to encourage you to get back with your sales rep and learn a little bit more about this whole thing about virtual care. Okay, so remember that virtual care is a service that you have here through American Business Systems. The telehealth industry is driving that because it allows the doctors to see the patient's vital signs, their blood pressure, their temperature, all remotely. So they don't have to, Mrs. Smith doesn't have to write down all of her blood pressure readings. It automatically goes to the doctor's EMR system. Okay, so there's a lot of growth here. So there's a lot of technology that has really burst out of COVID. I know that COVID, whenever it happens, it was a big disruptor. However, we all know, those of us that are CEO minded, we know that big disruptors like that actually promote new technologies and new opportunities. Okay, so think about this. What I've shared with you for the about 30 minutes so far, I'm giving you information that is driving this industry because it's giving you more technology behind you to go out there and even be better at what you're doing. And for your doctors out there and for their needs, it's going to be able to actually help them tremendously. Okay. Sankar is asking, do we need certification or degrees to be able to secure a business? What is the Guarantee ABS training alone to hand us a business? All right, so you don't need a specific certification or a degree to do this. Remember, we provide everything that you need, which is including a certification as a certified medical revenue manager, not a certified medical biller, because we encompass that even further than just medical billing. If you'll see all the different services that we have, Shankar, we are expanding it out even further. Like I said, virtual care. There's not even another medical billing business opportunity out there that has virtual care, which is remote patient monitoring, as one of their services. ABS does. I mean, we saw the future. We were seeing where it was going. We saw where things were going with telehealth medicine, the need to get patients' vital signs remotely and them not having to write all that down. So you don't need that. Okay. Now there is a guarantee that I'm going to talk about that again, that no other business opportunity or franchise actually has out there. But I'll also tell you that there is not an organization out there that is a business opportunity or a franchise out there that's just going to hand you clients. Okay. This is a business that you can't just hand out clients. There's no business out there that does that. We're going to show you how to build your reputation in your marketplace out there, because this is a relationship type of business. Remember, I said it's almost like you're the financial advisor for a doctor. And whenever somebody opens up some financial advisor group, nothing's out there that gives those folks clients either. So, but we've got not only the education that you're going to need to become certified as a certified medical revenue manager, but we're also going to educate you and show you how to get your first client. We will be with you until you get that. Well, not even until you get your first client. Whether it's one client or 10 clients, we're always here to help you with that. So hopefully that helped answer your question. Now remember, if you don't mind giving me a thumbs up or a heart or something to let me know that I've answered your question properly. If not, I can always come back to it a little bit later. Kimberly is asking, can you provide medical billing services for a company that you have ties with, such as you may be a partner in or already providing other services such as physical therapy, or would that be a conflict of interest? No, I don't see that it would be a conflict of interest unless you are one of the providers. Okay, so you might want to check that out. Okay, but if you're there as a consultant, or you're there as an office manager, or you're doing something else and you're going to do medical billing for that group, I don't see that would be conflict of interest. Okay. All right, let's move on. Man, I told you this hour is going to go by quickly. We're already at the bottom of the hour. Manageable expectations. All right, so this is one of the things about comparing traditional franchises and other brick and mortar type startups to a medical billing group here, because you don't need a brick and mortar. You don't need to go to a school for 6 months to a year to get all of this. What we're going to be able to do is help you gradually build up your clientele to where, again, eventually you're moving through it pretty quickly, because the first client that you ever get is going to roughly bring you in anywhere from $25,000 to $50,000 in revenue. Okay, now that's gross revenue. You're going to have a couple of expenses to go along with that, but I can tell you this: what you don't have out of that are franchise fees or royalty fees. When you're making $25,000 or $50,000 a year, that $25,000 to $50,000 is yours. None of that comes back to us. Okay, so that's what you need to make sure that you understand. So your gross annual per physician client is about roughly $25,000 to $50,000. Now, if you want to get a real detailed look at that, you can go to our website. If you go to the scroll down to the very bottom of the website, there's some, with every website, there's some links down there at the very bottom. There's one in there. It's called the income calculator. If you want to, go grab that link. Then you can put in that I want to see one doctor that sees about 25 patients. I want to charge them about 6 or 7%. It's going to, the minimum reimbursement for those are going to be $120, $125. And then it's going to kick out a projected outcome for you whenever it comes to that. So LaTanya said, that's a good idea for me. I like that. Okay. All right. So your commissions on insurance and patient payments, this is what you're going to be making. You're going to be making anywhere from 5 to 10% on every transaction that you put out. So if you're thinking about commissions, people look at it like that. This is your billing rate, if you want to call it. It's going to be anywhere from 5 to 10%. Okay, you're going to work with one doctor. Get this, folks, a minimum or a maximum of about 2 hours a day. Okay, for one doctor. So imagine that you're making 25 to 50,000 on basically 2 hours a day. So that's why you can see here, basically, you can, with 3 or more clients, have a full-time income replacement. Okay, so you can see that if you had 3 doctors at $50,000, you're at $150,000 a year, working about 6 hours a day. So this is manageable expectations, is what we kind of like to talk about that. All right. Any other questions? Tanya, I'm going to take yours down. I appreciate you sharing that with me. And then Fonnie, I'm just going to keep your question up over there. Okay. All right. Resilient. This is one of those resilient type businesses. It is recession proof. or recession resistant, should I say. It's you can work from anywhere you want to, and it's what we call kind of future proof, because it's whatever happens in the future. We always know again that people always get sick. Doctors always need to get paid. So medical billing is one of those business categories that performs consistently through recessions, pandemics, economic turndowns, because healthcare demands, they never stop. Okay? So it was kind of funny. Last night I was driving in from that meeting from last night. I drove by two brand new businesses in my little community, and I looked at those, and they are recognizable franchises, okay? Food type franchises. And at 7:30 last night, there was one car in front of both of them. And I'm just thinking, really, how long are those people going to be able to survive? It was very costly to get the building. These are two, what do you call those that are like in a shopping area, the shopping center areas, So side by side, there is a ice cream type place, and the other one's a sandwich type place shop there. And I'm just thinking, both of those I know are franchises, and I know what basically both of them cost. And that's a lot of money, and a lot of real estate, and a lot of everything else that goes along with that. And I'm thinking, you're having to scoop a lot of ice cream, and you're having to sell a lot of sandwiches to get that done. And just knowing that across the street there's a burger place, and there's just this. This is the way my mind thinks, and I'm thinking, I'm so glad that I got into healthcare, 18 years ago, because healthcare has grown, and it's helped me grow. And if you want to know, you can ask me, did I own my own medical billing company? So Fonnie, all of your questions that you're asking about me, or not about me, but about, is this industry going to be a good type of industry, and what kind of value add can we offer? I'm telling you, if once you get into this, your mind's going to explode. And I tell you, once you go through our training, you are going to find out that, gosh, whatever Eric was trying to tell me on these webinars, I didn't get it then. I get it now. Okay, so I'm not even going to say it straight. Trust me. Just what I'm going to ask you to do is keep plugging away with all of your education, because the sources that I'm sourcing right now, you can see is from the U.S. Bureau of Labor Statistics last year. So here's some things that you can think about. It's 100% remote operation. You can run your entire business from home. Healthcare providers now actually prefer remote billing partners over in-house staff. Now, this is information that I'm getting from the U.S. Bureau of Labor Statistics. All right, 9% job growth. Okay, this is the Bureau of Labor Statistics job growth. That billing related openings per year is a testament of the surging demand. So this is from 2023 over the next 10 years. This is what's going to happen, and it's HIPAA compliant demand. Listen, what the doctors have to deal with whenever it comes to HIPAA compliancy, making outsourced experts more valuable to small and mid-sized practices. Because again, you got to remember, one of the other services that we have is what's called Compliancy Guard. Now, so far, listen, folks, I have touched on medical billing. This is why I'm telling you that we certify you as a certified medical revenue manager and not a certified medical biller, because we have other services you can provide. I've already talked a little bit about the technology out there. What's driving telehealth is remote patient monitoring. Well, we have that as a service for you. Well, doctors are in deep demand of having HIPAA compliancy within their office. We've got Compliancy Guard as part of one of your services. So you're not just getting a medical billing business package. You're getting a revenue cycle management package that includes even things like remote patient monitoring and HIPAA compliancy. So It's more than just what you think on the scratch of the surface. So that's why I'm encouraging you to get back with your sales rep, do some deep diving on all of our other services here. I don't have time to go through all of our services, but I'm just touching on parts of these because it's what's driving the market here. So we're not just settled in with, hey, we've got a great billing platform and we're going to show you how to do it and you're going to get a little certification from us. We know it because it's driving our own business, because it's helping our current group of business owners already. All right, revenue cycle management. It's an explosive growth here of what's going on. We know that artificial intelligence, value-based care, electronic health records are exploding revenue cycle management opportunities. Okay. How do we know that? Because the revenue cycle market size in 2025 is $163.8 billion industry. And over the next few years, it's going to grow to $486.5 billion in projected revenue cycle management market to 2035. So these are another part of what you're thinking as a CEO. These are now what I shared with you earlier. Those were just the healthcare growth. Now I'm talking just strictly revenue cycle management numbers here. So you're going to have 11.5 annual growth rate, a decade of opportunity in real revenue for entrepreneurs just like yourself. Okay. So it is exploding as we talk. Okay. Any other questions? Okay, here's one. What are the typical expenses on these annual revenues that we can expect? Okay, so great question. Here's something you got to know, and I'm going to answer to you in a little bit wider answer for you. But there is a one-time investment. Okay, and I'm going to touch on it here in a little while, but it's a $35,000 one-time investment. There are no franchise fees. There are no royalty fees. Okay. So you're not paying American Business Systems another dime. Okay. You're going to have a lifetime of support, lifetime of training. Anytime that we have new services that come out, you're grandfathered into those automatically. Okay. So you're going to get anything that we have in the future that we might not even know about. Now, Adam's working on some stuff. That's why I want to interview him early on in 2026. So I was able to capture him at the last Wednesday of the month. Going into March which will be the last month of the first quarter. Because I know that if you're brand new at this, it's probably going to take you a good 60 days trying to make your decision here. So you're going to be getting some really great information of what Adam's got up his sleeve or what's coming up and ahead. So you're going to get all of this. So, but your expenses, you're going to have normal business expenses, your cell phone, your internet. If you're going to buy any extra equipment, you're going to need that. You're probably going to need to pay to get yourself set up as an LLC. You're going to have a monthly cost for hosting your website. Although that you're getting a website from us, you got to host it. We don't do all the hosting, because if we host it, it would be americanbusinesssystems.com / mymedicalbillingcompany.com, whatever. Those big old long, crazy names. So Shankar, I'm just letting you're going to have typical business expenditures. Okay. But it's low overhead because you don't have to go get a brick and mortar place. You can run this out of the back bedroom of your home. You probably already have internet service already. You probably already have a cell service already. Now what you're able to do is take those expenses that you didn't have a write-off on, and now that you're a business, you can roll those into your business. Now, I'll say that kind of tongue-in-cheek here, because obviously I'm not a CPA and I'm not an accountant, and I'm not an attorney here. I can just tell you that I know as business people, there are certain things that we are able to expenditure to try to help bring down some deductions there. So Shankar, hopefully help answer your question there. Let's see. Okay, great. I finally got a thumbs up there. Thank you. Appreciate it. Kashab is asking or saying there are a lot of EHR, EMR systems are now integrated with billing capabilities. Does that have any impact on ongoing impact? No, not whatsoever. Kashab, I remember whenever EMR was just coming out, and everybody thought this was going to be the end of the world because there's no longer going to be a need for medical billers. It actually increased the need for medical billers. It's the same thing with artificial intelligence. I think it's just going to increase the need for medical billers because the doctors don't have time to deal with everything, keep up with everything, deal with their patients. See, folks, again, I'm gonna share the story with you with the doctor that I spoke with last night, and she told me frankly, Eric, if I could just see patients, if I could just see patients and not have to worry about the business side of things, that would be the dream of my life. Let that kind of sink in a little bit. As long as they're getting paid, as long as people are doing what they're supposed to be doing, and it allows the doctor to literally see their patient that's really, really hurting, and they're not having to worry about how they're going to get paid or if they're going to be able to keep the lights on or they're going to be able to pay their current staff. Remember, they'll only pay you on what you help them earn. So if you don't help them bring in anything, they're going to just not pay you and they'll fire you. But if you're helping them get their money, then obviously there is some tie to what you've helped them bring in. Unlike if they've hired somebody at $50,000 and they're not bringing in what they're supposed to be bringing in. So you can see a lot of that is there. Okay, so hopefully that helped you. But no, it's not going to impact anything whatsoever because EMR systems and billing systems have been connected already for the last 10 years. So nothing new there. All right, we got about 15 minutes left. I want to get to this. I think this is our last part. Driving, what demands that are driving healthcare? What's really driving healthcare? Well, to deal with the monkey in the room or the elephant in the room, whatever you want to call it, AI is here. And I say the rapid growth using AI billing for smart billers who understand automation are in the highest demand. So let me help break this glass ceiling here whenever it comes to AI. AI is here. It's not going to stop. We might as well run it as long as we can. Like I said, I don't ever think it's going to take away from the one-on-one dealing with a doctor personally about their finances. Okay. The telehealth explosion. I've already mentioned that. And we've already got it set up to where if a doctor wants to do more telehealth visits, we've got a solution for them that they can remote monitor their patients by a scale, a thermometer, blood pressure, glucometers to check their blood sugar. All of that's there. I've already mentioned about the regulatory complexity that is out there. Folks, the great thing about it is the doctors don't have time to keep up with HIPAA compliance, let alone with anything new that's coming down the pipe from CMS or the Center of Medicare Services on new codes, whether they're ICD-9s or ICD-10s or the CPT codes. We got you covered there. Cloud-based helps. Obviously, server-based systems are out the door. If you're dealing with somebody and all they have is a server-based, and what I mean by that, they've got some server sitting in somebody's office that you can remotely get into, is a disaster just waiting to happen. Okay. Aging population, 60 plus. Folks that are 60 plus are just doubling by the year 2050. Okay. I'm in that market. I'm in the 60 plus age range already. And it just means more patients, more claims, more need for expert billers. And then lastly, there is, let me say this again, there is a private practice growth. Doctors that got sucked in to becoming employees during COVID are actually trying to figure out how to get out of that and become more independent, be better providers, and let them have their own future instead of just being employees of some hospital system. This is where it's going. Okay. So, all right. Any other questions so far? If not, I'm going to just kind of wrap up here with why ABS? Okay. All right. So why American Business Systems? Number one, and Mauricio, this is part of your answer here. Number one, ABS has been here since 1987. Actually, before that. Okay. But it's been around for a long time. And if you think about it, I got married in 86 and I'm about to celebrate our 40th anniversary with my wife. So ABS has been around for a long time. The Phillips family have been doing billing since 1987. They formalized it all in 1994. ABS is the nation's most effective, that's what I probably should have put it there, medical billing business system out there. They've helped literally hundreds of thousands of people get started as an entrepreneur, getting started in medical billing. Some of those folks are still in it. Some of them have grown their business in other aspects of healthcare that have gone beyond. And some of those folks that have started years ago have now actually brought new services to the platform. So we're not just selling you a practice or some type of package here. We're actually trying to help you build a business. And yes, Mauricio, client acquisition is always in any business the biggest hurdle. Once you get that, then it's going to be fine. People always ask, is the market saturated? That's kind of like asking, are the oceans full of water? And I don't mean that in any slight of way of anything. But let me say this. If there's a healthcare provider out there, someone's doing their billing. Someone is literally doing their billing. It's either the doctors themselves, their spouses, a friend of theirs, an employee of theirs, or some other medical billing company. Okay? And I'll tell you, there are billing companies that come and some of the billing companies that go. And I think it's all because they don't have the services nor the training that ABS gives you. Because not only are you going to get your first initial training, which is almost 2.5 weeks of very heavily in-depth training there, but there is also a more advanced training that we just recently come up that's more like a master's degree whenever it comes to medical billing. Plus, you've got the support here of American Business Systems, which means that you have an 800 number that you can call from 9 to 5 every day and literally get a human being. Now, let me ask you, do you prefer to have an artificial intelligence answer your questions, or do you prefer to have a human being answer your questions? Now, our human beings may use artificial intelligence to help get you the answer, but you want to talk to a human being. It's the same thing with a doctor. A doctor may want to ask questions about their medical billing, but they would rather talk to a human being than try to talk to some robot out there and not have any empathy of what's going on. Now, the doctors don't care what you use. They don't care what tools you use to make sure you get their funds in. This is part of it. All right, number 2, ABS is the nation's largest network of certified medical revenue managers in the United States, hands down. We're here. We're here to help you with that. And we have an all-inclusive package. One investment guaranteed, $35,000. We're here to help you. We've got software that's backed by NextGen, RxNT, and more. We've got live training. We've got marketing tools. We've got ongoing support. Plus, we are the only ones that has a money-back guarantee. No hidden fees, no franchise royalties, no surprises. We're here to help you with that. So, any last-minute questions? Mauricio, hopefully that helped to answer your questions. The market is not necessarily saturated. I mean, if you would say that, then every doctor's doing billing. There's no reason to do this at all. It's just finding the right one. Okay. All righty. Okay, so we're at the end here. We'll explore why medical billing, and folks, we got about 6 minutes, and so finally going to get to Fonny's question. All right, so you can answer this later. The reason I asked the question is how do we present ourselves in the market of doctors who have already signed up with other companies? What value add? Okay, so I've hopefully answered some of those questions for you throughout the presentation. Today was not the day. I'll tell you when. I'll give you a date here. Let's see. Let me pull up my schedule. There is a couple of dates I want you to write down. February 25th, which is next Wednesday, I'm doing the interview with Adam Phillips. Okay. So I want you to be on here. If I didn't answer your question today, Adam's here to help answer any other questions. March the 4th, how does the latest technology improve medical billing? We're going to go through that. On March 11th, we're going to be interviewing a brand new top performer already in medical billing, Robert Vasquez. So you're not going to want to miss that one. And then on March 18th, if you haven't made your decision by then, I'm going to be going over how to build your network and connect with leaders in healthcare, which is going to be Alisa, one of the best ways to secure clients. Okay. So we've got the answers for you. Now we do have some in the hopper already, some other webinars that we've already done. So if you want to go back through those, there are some webinars there that you can kind of go back through and see, how we help you get clients or marketing or anything else like that. You can put that in there.